There are a number of unnecessary rehospitalizations. Recent data show that 1 in 5 Medicare beneficiaries that leaves the hospital is going to be readmitted within 30 days, and many of those are said to be potentially preventable.
Don't duplicate the services that are already in the community.
Our county is small. There's 9 nursing facilities that are in our cross continuum, and we are very competitive. But it's been an opportunity for us to get to know each other. For me personally, I think I've gained way more in getting together with these folks and learning from them and what they're doing in their facilities than I could have ever wished to teach them.
In the care transitions work, so much of what happens in the early stages of a community coalition and the building of a community coalition is growing awareness between the community members of who their partners are, finding out just who the stakeholders are in their community, because we're about the patients here. That's what we're centered on. And it's whoever intersects and interacts with the patients, those are the people we want to have in the room in our community coalition.
I met Carol Higgins from Qualis at Pierce County meetings that I was going to, and I kept saying to her, I would like to start this work in Kitsap County. How do I start this work in Kitsap County? So she found Lauren, newcomer, who is the quality director here at Harrison, and so I came to the hospital. I was very excited. This is going to be the first time that I've talked to the hospital about this work, and I talked about the things that we were doing at my facility at Stafford. She talked about the monitoring and the initiatives that they had been working on, and we just connected.
It's really kind of opened my eyes to the problems that other facilities have, and sitting down together and brainstorming and coming up with solutions has been very valuable to me in the facility that I'm running right now.
I thought it would be a perfect scenario to be able to go to the hospital when we had a rehospitalization and sit down with someone at the hospital and say, this is what happened, this is where the failure was, this is where we could have done better, and to have that hospital person take that information and do something with it.
You took everything, all the resources that were already here, you leveraged them toward a common goal, and look what you've created.
I've been a nursing home administrator since 1989. Through the years, I never imagined I'd be standing in front of over 100 hospital employees explaining how skilled nursing facilities could be their strongest partners in reducing unnecessary hospitalizations. That if we come together and improve communication between each other, we can improve care transitions and the patient's healthcare experience. Skilled nursing facilities can help to identify high-risk patients and provide support and education in a safe environment. Our cross-continuum team has worked hard over the past year just connecting and learning from each other. We've shared some successes and failures. I'm excited to see what we can accomplish together next.